the fast-paced, relentless world of corporate finance, Amira, a 27-year-old, hardworking and ambitious professional, finds herself caught in an unending cycle of stress, pressure, and expectation. Every day is a race against time, with mounting deadlines that feel impossible to meet. Mistakes, they are not an option. The weight of her responsibility grows heavier with every passing hour, leaving little room for rest, balance, or peace of mind. Amira pushed forward, determined to prove her worth, but at what cost? Wow, hi Amira.
Oh, hi!
What are you doing?
Just preparing for
Wow,
work.
so many tasks to do.
Yeah, it's a lot, honestly.
Good luck.
Alright, okay, bye.
See you at lunch.
Alright.
Amira sits at her workstation, each keystroke arranged against time, as she tries to keep up with the relentless pace of her demanding job. Her focus is intense, but the strength is undeniable.
Hi Mira!
Yeah?
Here's the report that boss gave to you to analyze it.
Oh, okay. Let's see. Is there an Excel version of this?
Oh yes, I will give it to you right away.
Okay, thank you.
Okay, bye-bye.
Alright, bye. Again, another report? Oh my god, the workload. I just finished this after I finished this one. What? Oh my god, why is it so messy? I swear I did it correctly. Oh my god.
Farzana Amira, what is this?
Yes?
Amira, why your work is so bad? I want you to redo it again, okay? I want it by tomorrow on my table.
Okay, I'm so sorry.
Do it ASAP.
I redo it.
Despite her relentless efforts, it's never enough. Day after day, long hours at the office leave her utterly drained. Each critic chips away at her confidence, making her question her abilities. Yet, Amira refused to give up, pushing herself beyond her limits, desperate to prove her worth.
Oh my gosh, I'm so tired. I have a headache. But my work is so many. Oh, another overnight.
As the night grew, Amira with a heavy heart picked herself up. The quiet hum of the office feels deafening as she packs her belongings. Her mind was packed with future deadlines and reports. Another late night, another missed chance to rest. For Amira, overtime has become the norm, not the exception.
I'm so tired. Since I'm really stressed, I'm gonna eat all of this. Oh, I'm so full. I already ate 5 packs of Maggi. But I'm still feeling a bit hungry. Maybe I eat some snacks or chips.
Late nights at the office continue at home. Amira's body is drained, her mind racing, and her heart heavy with anxiety. Her head drops, the pain sharp and relentless. Overwhelmed by the pressure, she turns to the only thing she believes can offer relief: medication. Pills for sleep, for stomach pain, for headache. Each one a temporary fix. One pill becomes 2, then 3, as the boundaries between seeking relief and losing control begin to blur. Amira spiraled deeper, her struggle invisible to those around her, but everything too real within her.
Oh my gosh. Honestly, this is so annoying. Just 1 more hour. We can do this.
Get it, girl. Mira? Mira? Hey, Mira? 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 It's already 8 a.m. Are you okay? You're so sweating. Oh my babe, your room looks so stressful. What time did you sleep last night?
I'm not sure.
Don't you say that you finished all these tasks, eh? Are you okay, babe?
No, honestly, my upper stomach feel a lot of pain. I can't breathe normally. My head hurts.
Oh my god.
I feel like vomiting.
I think we need to go to emergency right now, immediately.
I don't know. I think it just may be a cold.
No, it's not the usual cold or fever, okay? We need to go to emergency and see the doctor, or you are getting more worse. Let's go.
Alright, okay.
Emergency! Doctor! Doctor! Yes?
Well, Father Anak Amira.
Yes, doctor.
Yes.
Good morning, Puan Amira. So, firstly, I will measure your body temperature, okay? Seems like your body temperature is slightly higher than normal body temperature. How are you feeling today?
Honestly, not very well, doctor. I've been having this severe pain in my upper abdomen that radiates to my back. It gets worse after I eat, and I've also been feeling nauseous, and I even throw up a couple of times. I noticed that I have a rapid pulses, and I think I'm having a fever.
I'm sorry to hear that. How long have you been experiencing those symptoms?
The pain started about like a long time ago, but it's been getting worse. I thought it might go away on its own, but now it's really unbearable.
See, based on what you've described and the initial test we have done, it appears that you might have pancreatitis. It's an inflammation of the pancreas which can cause the kind of pain and digestive issues you're experiencing.
Pancreatitis, is it serious?
It can be, but the severity varies from person to person. Right now, I need more detailed information to confirm the extent and cause of the inflammation. So that's why I'm going to refer you to do the abdominal ultrasound.
What will the ultrasound show?
So the ultrasound will give us a clearer picture of your pancreas and the surrounding area. Specifically, we will look for signs of swellings, blockage in the bile, or pancreatic ducts or gallstone, which are a common cause of pancreatitis.
Gallstones? Could I have those?
It's possible. Gallstones can block the pancreatic duct and trigger inflammation. The ultrasound is one of the best tools for identifying gallstones or any other structural abnormalities.
Is it a painful procedure?
Not at all. It's a non-invasive and painless test. A technician will use a small device called a transducer to glide over your abdomen. It uses sound wave to create image of your internal organ.
Okay.
So right now, I will put you to the emergency wards.
Hi, Assalamualaikum Puan Amira. I am Fatiha, your sonographer for today. So I want to do ultrasound for you, and we need to scan 4 different types of organ. First, we need to scan your kidney, gallbladder, liver and pancreas. Before we scan, there is a few steps that you need to prepare to get the best quality image. First, for the fasting instruction, since you are here in emergency department, I will need you to avoid eating or drinking anything for the next 4 to 6 hours. This includes food and drinks. You can have a small sip of water if absolutely necessary. The reason for fasting is because we need your stomach and surrounding organ to be empty to get clear and accurate image. Food or drinks can interfere with the scan results. Next, we also need your bladder to be full. If you have passed urine recently, I will ask you to avoid going again and try to drink a couple of glasses of water now, if you are able. A full of bladder helps us to see the pelvic organ and other structure more clearly. If you are feeling uncomfortable, let us know and we will work as quickly as we can. I understand this might be a bit uncomfortable, but these steps are really important to help the doctors get the information that we need to treat you. Do you have any questions or concerns?
Oh no.
Okay, see you again in few hours. Hi Palmira, right now we will do ultrasound for your abdomen.
For the patient care, patient is helped to sit on the bed and lay down comfortably. A blanket was put on the patient to add more comfort. Sonographers wear gloves to protect themselves and patients from the spread of infection and illness. Next, 225 MHz curvilinear ultrasound transducer is used for the abdominal scanning. Then, acoustic gel is put on the surface of the transducer.
First, I want to scan your pancreas.
Transverse view, probe is placed inferior to the subcostal margin in the middle of the abdomen at the level of xiphoid. Left lobe lever is used as an acoustic window. Patient is asked to deep breathe in and suspend to improve visualization. Then, the patient is asked to drink water and a splenic window is used for better visualization of the pancreatic tail.
Next, I want to scan your liver, so please breathe in and hold.
Longitudinal view, probe is swept all the way out of the subxiphoid. Small incremental movement is made from the left of the midline, moving along the right subcostal margin to the right lobe of liver. Transverse view, probe is fully swept at the subcostal approach, angling probe up and down and left and right.
After that, I want to scan your gallbladder.
Long axis view, probe is placed just below the right costal margin, then probe is tilted to fan through this region and the gallbladder is located. Probe is rotated and swept as needed to obtain the full long axis view. Probe is angled caudally and cranially.
Okay, Palmira, now I want to scan your right kidney, so please breathe in and hold.
Longitudinal view, probe is placed at the lower intercostal space in the mid-axillary line. Lever is used as the acoustic window, then probe is aimed slightly posteriorly pointing toward the kidney. Then, the right kidney is measured. The normal measurement for kidney is 9 to 12 cm.
Okay, Palmira, now I want to scan your left kidney, so please breathe in and hold.
Longitudinal view, probe is placed in the lower intercostal space on the posterior axillary line. The placement will be more cephalad and posterior than when visualizing the right kidney. Then, the left kidney is measured. The normal measurement for left kidney is the same as the right kidney, which is 9 to 12 cm.
Morning, doctor.
Hello, Puan Amira. I am Dr. Daniel, and I'd like to tell the result of your ultrasound and explain what's happening with your condition. So the ultrasound shows signs of pancreatitis, which is an inflammation of your pancreas. This condition can also impact other organs, and in your case, we are seeing some effects on your liver, gallbladder and kidney as well. So let me show you the image we've taken so you can get better understand what's going on, okay? So firstly, here is your pancreas with swollen and inflamed. This is consistent with pancreatitis, and that's why you may experiencing pain and discomfort in your abdomen. So you can see right here your pancreas with the thickened pancreatic tail. So secondly, here we also notice some changes in your liver. The inflammation from the pancreas can sometimes spread to nearby organ, and this might be contributing to the symptoms you are feeling. Okay, you can see right there your liver is slightly enlarged. So after that, your gallbladder also appears to be affected. It could be due to gallstones or inflammations linked to the pancreatitis.
Oh, so here the gallstone, doctor?
Yes, betul. This can cause abdominal pain and jaundice, okay? So finally, your kidney are showing some mild signs of stress, which can happen when pancreatitis affects the overall balance of fluids and inflammation in the body. Okay, so this finding help explain the symptoms you've been experiencing, like abdominal pain, nausea, or feeling generally unwell. So it is important to treat this promptly to prevent further complications. Usually, for patients with pancreatitis, we focus on supportive care, which means hospitalization, to ensure you get intravenous fluid to prevent dehydration, pain management, and sometimes fasting to let your pancreas rest. Once the inflammation settles, we determine if anything like gallstones needs to be addressed to prevent further episode. So why do we suggest you IV fluids? So firstly, it's because pancreatitis frequently causes nausea and vomiting, hindering oral fluid intake, while the inflammation can lead to fluid leakage into the abdominal area, causing a significant fluid deficit. So secondly, IV therapy helps maintain blood pressure and prevent circulatory shock by replenishing lost fluids. And third, adequate fluid resuscitation is crucial to ensure proper blood flow to the pancreas, which can help prevent further tissue damage and necrosis. And finally, early and aggressive fluid resuscitation is often recommended in acute pancreatitis to minimize complications. After getting IV fluids, I'm going to prescribe you a strong painkiller to help you manage the pain. So pancreatitis is often causes severe abdominal pain because the pancreas become inflamed, and this irritation can be very uncomfortable. By controlling your pain will help you feel more comfortable while your body heals.
That would be a relief. What about antibiotics?
Good question. Although not all cases of pancreatitis require antibiotics, I'm prescribing them as a precaution. There's a chance of infection in the pancreas or surrounding tissues, especially if there are fluid collection or damaged areas. The antibiotic will help you to prevent or treat any potential bacterial infection.
I see. So the antibiotics are more of a preventive measure?
Exactly. Inflammation from pancreatitis can sometimes create an environment where bacteria can grow, leading to complications like abscesses or infected fluid collection. This medication will help minimize that risk. So after that, it's important to you to adjust your diet to allow it to rest and heal while still providing your body with the nutrients it needs.
That makes sense. What should I be eating then?
For now, we'll start with small, lower-fat meals. Fat is the hardest for your pancreas to digest, so avoiding it will reduce the strain on your pancreas. Initially, you might find liquids like clear broths or oral nutritional supplements easier to tolerate. As you recover, we'll slowly reintroduce easily digestible solid foods to you.
And what about things like protein or carbs?
Protein is essential for healing, so we ensure you getting enough from sources like chicken, fish, or tofu once your pancreas can handle solids. Carbohydrates are generally easier to digest and will provide you with energy. Think of things like rice, oats, or maybe boiled potatoes. Again, in small, frequent meals.
Are there foods I should avoid completely during recovery?
Yes. Avoid fatty, fried, and processed foods as they are hard to digest and can worsen your symptoms. Also, I suggest you to avoid alcohol entirely. It's one of the leading causes of pancreatitis and can trigger another episode.
I see. That sounds manageable. Thank you for explaining everything so clearly.
Oh, and finally, if needed, we will do ECRP, which is endoscopic retrograde cholangiopancreatograph. It is used to locate and remove a gallstone. A long tube with a camera is fed through the mouth and digestive system to the bile duct. This tube also is used to get tiny tools to the side to remove the stone and clear the bile duct.
Oh, okay.
So I think that's all from me.
Alright, thank you, Olga. Beautiful and yummy breakfast. I love fruits. Wow, so delicious.
Wow, Amira, very good, right?
Yeah, no more instant noodle for breakfast. It's fresh apples.
Wow. Good, Amira. I'm very glad with your life right now. Very cheerful, very demure. So, Amira, please remember what doctor advised you to only eat healthy food, no processed food anymore, okay? And please prioritize yourself and don't put too much burden on yourself. Okay, you are still young.
Okay, I got it. Thank you, Arisa.
Okay. So, what are you going to do after this?
I'm just gonna list out and I'm gonna have some tasks to done because I am on leave today.
So, make it organized and don't forget to tag us again. Okay. Ciao for it. Bye.
Bye, girl.
Amira's life has taken a new turn. Her mornings are brighter now, filled with small but meaningful rituals such as healthy meals, deep breath, and moments of gratitude. The weight that once burdened her has lifted, replaced by a newfound energy and joy. With each passing day, Amira feels lighter, more in control of her life. The happiness that had once seemed out of reach now radiates from within her, proof that even the darkest time can lead to brighter tomorrows. She starts each day with purpose, her once chaotic routines replaced by a well-organized to-do list. Tasks are neatly prioritized, giving her a clear direction and a sense of accomplishment as she checks each one off.
Wow, I actually finished everything early. Now, time for relaxation.
I fly like paper, get high like planes. If you catch me.
Oh, dah! Okay, selesai. Okay.
Lepas tu angle kat atas kepala macam. Hai. 2, 3.
Amira Fazana. Okay.
Tiga.
Sebentar. Ha. 1, 2, 3.